Growing up in Canada, English is my first language, with Mandarin still in the process of being learned. Whenever my mother took me to the family doctor, conversations were often conducted entirely in Mandarin, since that's what they were both comfortable with, leaving me struggling to understand what was happening. As a result, I got used to letting my mother speak for me, especially when it came to medical decisions. Some vivid memories I have are of going in for vaccinations or flu shots. Doctors would instruct me to roll up my sleeves, use the alcohol wipes, and go directly in with a needle. However, I was never directly asked if I was comfortable or okay with getting the shots. As a shy kid, I never spoke up about my fear of needles, assuming that following my mother's lead and the doctor's instructions was just what everyone did. Looking back, I realize this experience highlights the importance of minors' capacity to consent. According to common law, there's no specific age of consent for medical treatment. Instead, consent is based on capacity, meaning a minor can consent if they can understand information relevant to the treatment and appreciate the foreseeable consequences of accepting or refusing it. At the time, I was around 13 years old, which may seem young, but I was pretty confident I was eligible. Furthermore, the College of Physicians and Surgeons of Ontario clarifies in their Consent to Treatment Act that physicians must assess a minor's capacity just as they would an adult, and if the minor is capable, consent must be obtained directly from the minor, even if accompanied by a parent or guardian. As an adult now, I recognize that without my mother pushing for my shots, I likely wouldn't have gotten them voluntarily due to my anxiety around needles. Yet, I still wish that the doctor had made an effort to communicate directly with me. It was not an issue of language barrier given that the doctor knew English and only spoke in Mandarin to accommodate for my mother. However, giving minors clear explanations about the necessity and consequences of any treatments can provide reassurance and help them mentally prepare. This is especially critical because decision-making practices vary culturally. A research article on informed consent in mature minors by Bocetta stated, "In China, regulations on decision-making contemplate the assent of the family. Autonomy is perceived rather as a collective versus an individual right. This means that in China, healthcare decisions typically involve family rather than being left solely up to the individual patient. In other words, autonomy is viewed as a collective family responsibility. This can also contribute to my mother's and doctor's choices, which contrasts with the West, where individual autonomy is typically prioritized." In conclusion, not only is the consent of minors important, but doctors also have a professional and ethical obligation to comfort and support all patients, including minors who may be afraid of undergoing any medical procedures. Addressing fear and anxiety is an essential part of providing patient-centered care, especially when working with children. This ultimately encourages greater trust and cooperation between young patients and healthcare providers.